All right, so many questions about how to tighten your skin. We are going to do a long video just breaking down the options that are out there. So what we're talking about here are skin tightening devices. Some of them tighten not just your skin. Some actually go deeper and tighten your SMAS, can even tighten muscle. And they do, for the most part, lead to the increased production of collagen, making more collagen. The problem is depending on you, how much collagen you make, how good your skin is at responding, the results with all of these devices can be unpredictable, and that can be quite frustrating for individuals. So let's break it down device by device. Devices on the market that are considered skin tightening are Ultherapy, Thermage, Sofwave, Exilis, and Emface. So starting with Ultherapy. Ultherapy is micro-focused ultrasound. It targets the dermis, so that's the second layer of your skin, as well as the SMAS. It can penetrate quite deep into the skin, and because of that, it can be really painful, and there are rare case reports of divoting or indentations that can be developed because it actually is destroying fat from the deep heat. It's very painful because it penetrates so deeply, and typically people get topical numbing as well as pain medication orally when they have the treatment. What's great about it is it's usually a one and done treatment, meaning you don't have to do a series. People, if they get a nice result, might do it once a year to sort of lift and maintain a raised forehead, eyebrows. What it's known for is lifting. This is not going to help with fine lines, wrinkles, crepiness. This is more of a lifting device to build collagen and really tighten things up. It is not like a brow lift, but it does, and the individuals that respond well to it, does do a nice lifting. The biggest complaint I get about it is that it hurts a lot and that the results are unpredictable. Thermage is another option. This is monopolar radiofrequency. It only affects the dermis of the skin, and it is less painful than Ultherapy, but when it works well, it doesn't work as well as Ultherapy. It oftentimes needs to be done multiple times. So you might do it every 3 to 6 months. You might do it once a year. What's lovely about it is it does have multiple hand pieces, so it can be done on your body, it can be done around your eyes, it can be done on your full face. It is time consuming, but it is not as painful as Ultherapy. One of the newer kids on the block is Sofwave. This is high frequency focused ultrasound, and it's in these parallel beams. I've experienced it, and for me, it hurts more than Thermage, but less than Ultherapy. And it is going to build collagen in your dermis, similar to Thermage. I think the results with it are better than Thermage. I think it hurts more than Thermage. It is one of these things where people sometimes do one, they sometimes do 3 to really maximize their results. It's a relatively quick treatment. It doesn't take as long as Thermage, but it is uncomfortable. Exilis is probably the most tolerable of the treatment options, but you have to do it in a series, and you have to do it in a series of at least 4. It combines monopolar radiofrequency with ultrasound, and it's a wand that can really be done anywhere. You can do it around your eyes, on your lips, on your face, on your neck, and it does build collagen, but building collagen doesn't necessarily lead to a visible lifting and tightening. And I would say that that is sort of the complaint of Exilis, of Thermage, and even Sofwave. If you really want that lifting, Ultherapy and Emface are the 2 that are going to really get that for you. Lastly, another new one on the market is Emface. Emface is different than the others because not only does it have radiofrequency, it also has high intensity focused electrostimulation. So they're going after your dermis by heating it, but they're also going after your muscle and building muscle by actually stimulating your muscles to contract. So what's nice about Emface is that you see the muscle building results faster. The collagen building for all of these takes at least 3 months. The downside of Emface doesn't hurt very much, but it is like Exilis in regards that you need to do at least a series of 4. There's a maintenance component where you might do your series of 4 and then do it every sort of 4 to 6 months to maintain that muscle mass that you've built with the Emface, as well as continuing to build collagen. Of the options out there, Emface is probably the most expensive, and then Ultherapy. And of the options out there, I think those are the 2 that are going to get you the best results, although the results, as I've already said, are unpredictable. I find Emface the least unpredictable. And what they showed in the study is when people do a series of 4 of Emface, they will see an increased lift in their cheeks with the building of their cheeks of a 1.5 cc's per side, and then a decrease in their jowl by 1 cc per side. And that's a pretty nice improvement. They are able to lift your eyebrows, able to lift your cheeks, and they have a newer attachment that works on the fat underneath your chin. All of these technologies don't have any downtime, meaning you can have them and immediately go out to dinner or go back to work, and you are not going to have changes to the top layers of your skin, except for your skin might look a little flushed. Your results for them really comes down to your skin and your ability to build collagen. Some of us are just not very good at that. It doesn't mean that you shouldn't do the treatment. Just know that you're not going to get as good a result as a 25-year-old with big, thick skin, really able to build collagen. I'm a fan of them. I feel like they're some of the safer options that are out there. I do Emface on myself twice a year, and it really comes down to, are you okay spending a lot of money for a subtle result? But the nice thing is that they don't have significant risk profiles. That doesn't mean that nothing can go wrong, but things rarely go wrong when you see a capable provider, and they are typically safe for all skin types.